just COVID-19. We were able to establish also partnerships with donors and donor institutions. We both had donations, local and international, both cash and in kind. We also, since Mary Johnson is part of faith-based organization, we were looking at partnering also with global ministries. We had also our maintenance of health financing, PhilHealth HMO, and availment of the IRM from PhilHealth. I know that this was also available to the other hospitals, wherein we were able to get a forward cash advance of 16 million. And last but not the least, we looked at essential personnel in crisis, wherein we looked at special risk allowances, and we had work at home mechanisms, and also we also had skeletal forces in order to lessen our risk and concentrate on the people that were focusing only on our response. So, right. Having said all of this, we continued on with our mission continuity plan. And just to show you a summary of, yeah, next slide, please. So, supposed to have a second slide kasi, but just to show you that financial wise, no, we were able to get that donations totaling around 24 million, and also in kind sources of worth 5 million, with our institutional budget of 4.5 million. So yeah, next slide, please. So this was just a total of the COVID cases we've had so far for this week. So we have a total of 791 who we have seen. Next slide, please. Yeah. So just a note on the hazardous waste. You know that PPE generates waste, and we had an estimated amount of 163,000. But we strategized so that next slide, please. We would look at washable and repurposed, reusable, and recyclable material, the non-woven type. So we were able to estimate savings of 339,000, more or less. I think my last slide is coming up next. No, just some pictures of how we are trying to handle our wastes with our PPEs. But there are present challenges there, as you can see. Yeah. And yeah, the next slide. So these are the ongoing lessons that we are looking at. It's very important for us to have an assessment and analysis because nobody expected this pandemic. It just so happened that we were able to do our strategic planning in January, and we considered the possibility of disasters in our strategic planning. So that was good, but not at this big change, that we're experiencing right now. Second is adaptability. You should be able to see how you can do the next mile with cost in mind and also keeping everybody safe. And but not the least is to be accountable with all of the donations and responsibilities that you're getting. You have to be accountable for every single centavo that is spent so that you can move forward with very good cost containment and maximizing whatever resources are there. So yeah, thank you very much for giving me the opportunity to share some of our lessons in capacity and what they call this financing in this COVID crisis. Thank you.
Thank you very much, Dr. Glenn. I know there's lots of things to share. We heard you illustrate the kind of conditions and challenges you met in the Mary Johnston, and we will have more time during the panel discussion today. But since you are limiting each of our panelists to a 5 minute presentation, we will now call on the next presenters, and we're happy to have with us here again one of our key members from the Indonesia in West Java. She is Dr. Herbie Norwenia Mega Reza, currently the operational director of the CahayaQalbu Clinic in Bandung District, West Java Province. Before being part of the said hospital, Dr. Herbie was a general doctor at the emergency department unit of Tanjung Pinang Government Hospital in Ria Island. And in terms of sustainability, she has plenty to share, even as they are also in the forefront of tackling the COVID-19 crisis in their own district, in the city of Bandung. So without further ado, I would now call on Dr. Herbie for her presentation. Dr. Herbie.
Okay, thank you, Raymond. Is my voice is still clear?
Yes, we hear you very clearly.
Okay,
Thank you.
thank you. Thank you for the time. First of all, please allow me to say hi and good afternoon to all of the participants and all of the panelists who has joined the GGHH virtual roundtable discussion today. So me, representing the CahayaQalbu Clinic Director of Operation, Bandung District, West Java Province, Indonesia. I would like to share you about how is CahayaQalbu Clinic coping with the COVID-19 pandemic in environmental accountability aspect. So if Dr. Glenn Paraso is representing the hospital in Mary Johnson at Philippines, please allow me to give any experience in my clinic in CahayaQalbu, West Java Province, Indonesia. Okay. In the first slide, you can see this is the map of COVID-19 response in Indonesia. This is the number. The data is taken from 12 May 2020, and this is the confirmed case of the positive COVID-19 in Indonesia. Today, we have about 14,000 confirmed cases COVID-19 in Indonesia, recovered about 3,000, and deaths about 1,000. So you can see the left side, that is the red zone that's spreading almost all over areas of the Indonesia, that it is informed us more than 50 patients confirmed as COVID-19 at that area. And you can see the daily case graph below. That is below blue line color. I can point this way. The blue line color is represent the total case of COVID-19 in Indonesia, and you can see the trending is still going up until today. For your information, the mortality rate in Indonesia now is about 6.8%, and the recovery rate of the COVID-19 in Indonesia reached about 20.7% now. And then, right?
Next slide.
Okay. This is CahayaQalbu Clinic. Yes, this is our facility. We have emergency department, outpatient care, and inpatient care with 15 inpatient beds, laboratory and radiology department, kitchen, laundry, and wastewater treatment department. Okay. We had encountered many general issues dealing with the COVID-19 pandemic at CahayaQalbu Clinic. The first, the number of the outpatient care is increasing, so it will complicate the health services through social distancing procedure. And the second is the price of PPE is raised higher day by day. So it has become burden our budget, and then also potentially increase the number of the medical waste. And the third is the needs of the purchasing of chemical for disinfection must be increased. So we have to choose the safer alternative to use the chemical agent with long period of utilization. We can go into the next slide. Okay, this slide. The need for thermometer and also for the sphygmomanometer in triage department is also increased. And we have to make sure that it's the mercury free. And also the needs for digital imaging and also for the rapid test laboratory. And we found that the amount of non-medical and medical waste become higher. So it needed to be collected faster by local waste collector and then biomedical waste transporters. This is a few initiatives we handle the issues. The first, how to reduce number of people inside the healthcare facilities. We are trying to do the teleconsultation by WhatsApp chatting with the doctor, and in order to decrease the crowd, and we can lowering the transmission possibility of the virus. And then we try to replace the disposable PPE with the washable PPE. For the third level of PPE, we use washable coverall suit. And for second level of PPE, we use washable surgical gown covered with apron from skin material. So it can saving our budget and reduce the medical waste of disposable PPE every day. So this is the little experience of our health workers. This is the apron that made by skin mattress material, and then the surgical gown from the outpatient care and admission care.
Next.
Okay, this is the next issue is how to find the safer chemical disinfectant for disinfecting agent. We know that chlorine-based disinfecting agent is very famous and popular in the market. So, but it is so highly toxic. So we are trying to find the safer one, and then we choose the chlorine dioxide. This is the comparison between chlorine dioxide with the chlorine. The chlorine dioxide will not react with many organic compounds, and the result doesn't produce environmentally dangerous chlorinated organics like trihalomethanes and haloacetic acid. So it is also classified as non-human carcinogenic. And then the chlorine dioxide is not have no corrosive effect at this infecting concentration, and it cannot react with the ammonia, so cannot cause the toxic fumes. Also, the chlorine dioxide is more soluble in water and need only lower concentration to kill the microorganisms and need the lower time to kill microorganisms compared with the chlorine. And it's really effective to kill viruses and chlorine-resistant pathogens, Giardia and Cryptosporidium. And so CahayaQalbu decided to choose chlorine dioxide. This is the label, Ecosys and Ecosys Sanitizer, to replacing the chlorine one. And we use also instrument decontaminating agent. We use that label, Virusol, and the surfactant and chelating agent is biodegradable. So this is the picture of the chemical disinfectant that
Next slide.
and how we had already eradicated all the applying mercury thermometer and sphygmometer in our department, and we had already processed our digital imaging at radiology department, so it can reduce the chemical demand, saves the water usage because it replaces manual wash of film processing. And last, it's still about being a great challenge in our clinic about biomedical waste management because the recommendation through the MWM rules 2016 amended on 2018-2019, the segregation has just divided into a few categories, but in our clinic still divided into two colors, waste bin, yellow for medical waste and black for non-medical waste. We still make it simple, but it's still segregate at the source of the each department, and the collecting staff will deliver it into the storage for about 2 days, and we will call for the medical waste transporter. Meanwhile, the general solid waste will be handed over to local waste collectors once daily. In our clinic now, the non-medical waste is vary about 15 up to 18 kilograms per day, and for the medical waste is about 6 up to 10 kilograms per day. And we had already passing the laboratory testing for our wastewater treatment quality. And this is the Yes, this is the picture of our simple divided waste bin, yellow and the black, and this is the storage of the collecting waste before. And I think the summary is the healthcare sector should not cause any adverse impacts on human health or the environment. Chemical agent and biomedical waste management become one of the challenging aspects today. So choose the safer way adjusted with your ability. So let's start beginning our step to reduce our environmental footprint because even a small action is valuable. I think it is for today. Thank you for the time. I'm sorry for the inconvenience because there is a short time of me. Thank you, Raman. Good afternoon.
Good afternoon again, Dr. Herbie, and thank you very much. Again, we will have more time for discussion and to respond to the questions of the participants after all the presentations are made. And just to remind you, you can raise your questions already by using the chat box of the WebEx. So please find it in your screen. Just shoot your questions, and we have Paeng who is sorting it out, my colleague, and we will entertain those questions during the open forum. Now, we're also happy now to have our third presenter, a colleague from the Vietnam National Lung Hospital by the name of Dr. Nguyen Huang Son. And we're so grateful to have you with us in this exchange on how hospitals can even improve on sustainability as we tackle the various challenges of COVID-19. So let me give to you Dr. Nguyen Huang Son. We hear you, but we just want to make it clearer. Can you speak again?
Yeah. Good afternoon.
Good afternoon.
Hello, everyone, and thank you for accepting me to be discussed here. And I hope to share about the solutions that will help you with COVID-19 pandemic. Next slide, please. I work as intensive care specialist in intensive care department. So in Vietnam, we have a system of lung hospital along all provinces with 64 hospitals with specialized tuberculosis and respiratory disease. And National Lung Hospital is the leading hospital of them, with two missions that eliminating tuberculosis and providing care for lung disease. We have a lot of experience in control tuberculosis and we have some similar with COVID-19 in the way to transfer from community, the way to prevent contaminate method to community. Next, please. Next slide. As soon as the information case and the new case rise daily went out to China to other countries but had not appeared in Vietnam, we have seriously looked about COVID-19. You remember that at that time, knowledge about the virus was very limited. We did not know the type of the way to transfer from animal to people, or had no vaccine or special drug. Moreover, information disseminated to the public is not always backed by a scientific fact. There not of fake news appear too much on the internet, especially on Facebook, that people little so confused, worry about COVID-19. But some other past people did not care or self-protect practicing. They simply thought that COVID-19 also as other kinds of flu could not develop severely. But again, that we also have some disease. Do you remember the SARS pandemic in 2003? then Vietnam was successful and has much experience to respond with a large pandemic like that. Now we also faced with COVID-19 seriously. Next, please. Lots of solutions given then. First of all, a hospital committee for pandemic prevention was established, with the leader was our hospital directory, and member was the head of key department. They meeting and discuss daily to update the pandemic situation and make suitable decision on. We prepare many situations uh, most most detailed as possible, and most of them done soon, so that we can have enough guide documents for our healthcare workers and patients or caregivers. For example, we have a protocol how to do in we examine a patient who treated with COVID-19. What should we respond if that patient positive with COVID-19? How to transfer them from the screening area to emergency coping unit? How to protect healthcare workers, caregivers, or the other patients? We did many methods to giving information for patients and their caregivers, also healthcare workers do, such as poster or banners or guide strategies. Especially, I introduced that in April 2020, after two hearing experts in our hospital wrote and published a guide book to help co-workers in all hospitals in Vietnam can practice well for patients who had not only COVID-19 but also have some comorbidities like tuberculosis, COPD. Next slide, please. And you can see we have posters everywhere in our hospital. We organize some short course to train for all healthcare workers, information for patients and their caregiver. One thing, so if we have had a chance to practice the assumed situation in our hospital. At that time, we hypothesized that we had a healthcare worker could be positive with COVID-19, and he had been contact with a lot of our co-workers. So, in a sudden situation like that, what should you do to control the risk of past infection of virus? And after that, only have a careful preparation so you can do it well if one unwanted event happens. So next slide, please. So this is a flow map for patient and visitor who will come in to my hospital, and all of them must complete the health declaration and check their temperature. And if they have some sign of risk, they will be examined in separate area, with a separate way. Okay, and if not, they will be taken examined normally. As you can see, we have a system to check the temperature. Next slide, please. And here we prepare the emergency response unit in 3 zones: the red, the 0, and green one. For each kind of risk, and base of all, we always be strict infection control prefect to protect healthcare workers, protect and caregiver in each separate area. Next slide. Okay. For especially, you can see for helping patients and community better, we have a platform that you can be installed easily on a mobile phone for Android or for iOS. So you can schedule an appointment with our doctors to take exam and be advised carefully. We also take the COVID-19 test fast and can give fast result for screening for and we did ourselves some personal protective equipment such as face mask. We did it ourselves, as you can see here, and some guide to safely reuse the mask. Some important masks like N95 or medical masks can be reused safely. Okay, next please. And the last one, with accompany with our government efforts, you know that the number of COVID cases in Vietnam is not increased now, and the number of negative reduced. A lot of patients are killed. Up to now, national does not document any positive case with COVID-19. Our healthcare workers and patients are safe, but we always alert with the risk of new cases. The best lesson learned is that we hope to make COVID-19 pandemic become the chance to end TB in 2030. In Vietnam, because this solution can become suitable and can be done to make healthcare system in the future, and especially if we apply it for the fight against tuberculosis, we will reach the goal to NTP soon in Vietnam. And thank you for the attention. Thank you.
Nguyen Huang Son, we appreciate your sharing, and we hope that beyond this webinar, we will be in the hospital. Now we are moving to the next presentation from the Philippines, representing the DOH Managed Hospital, Department of Health Managed Hospital, operating in Metro Manila, the Amang Rodriguez Memorial Medical Center. And we're happy to have Dr. Imelda Mateo, or we call her Dr. Aimee, who is the Medical Center Chief of the AMR MMC, which is a thorough green hospital, even prior to this COVID-19 crisis, and has been tested. And this is what she will share with us today. So I will turn over the microphone to you, Dr. Aimee. Thank you very much.
Good afternoon. Thank you, Mon. I would like to greet all our viewers, our participants. Despite the typhoon here in the National Capital Region, so it's good to share our experience in Amang Rodriguez Memorial Medical Center. So a little briefer backgrounder on my agency. Next slide, please. Amang Rodriguez Memorial Medical Center, or shortly the ARMMC, started some 54 years ago. In fact, today is the 54th year anniversary of its establishment since 1965. It's unfortunate that we had to spend it in this time of emergency, national emergency and pandemic situation. So it's a 300-bed capacity hospital, recently upgraded to 500 beds. We are already moving towards that, increasing infrastructure. Still, everything was put on hold because of this pandemic. So it's a tertiary teaching and training hospital under the Department of Health. It's a national agency, has been accredited by the Commission on Higher Education for paramedical students as well. It has 10 accredited training in different specialties and 1 fellowship training in ultrasound, MRI, and CT scan. It has been certified to ISO 9001:2015 for standards in training and service for the past 4 years, and we were recently recognized as a Silver Trailblazer awardee for performance over the system last November in the Philippines. Next slide, please. So I was tasked to discuss about human resource, but just to let you see how the magnitude of the um, patients that we cater to. So our center is located in the Eastern Metro Manila, or the National Capital Region. It's an end referral hospital, and our catchment includes catering to more than 1 million population. So as I have mentioned earlier, we have accredited residency training in 10 departments, different disciplines, and 1 fellowship training in ultrasound, CT, MRI. Next slide, please. So this is our green and healthy hospital journey in our institution. We tried to start with planning the plastic waste audit. That was mid-2018 with a healthcare team, with a GGHH team for Asia, headed by Mr. Mon San Pascual, but that did not push through. But we had initial plans on that. Till in August 5 to 9 of last year, there was a more intensive energy audit, Climate Smart Healthcare Group, which this also initiated by Healthcare Without Harm and GGHH team for Asia. And our own initiative, we started the creation of the Green and Healthy Hospital Committee with My Hospital Order in September last year. And we were also participants to the 5th Green Hospital Asian Conference in Singapore at Kutek Wat Hospital. In October last year, we had a first meeting, a general assembly of the committee. And in December, we formulated and put on stamp the subcommittees of this committee. We also did a short analysis research on the plastic usage and disposal of our medical center. This is a 1 month analysis, or a short study, that was funded by the Department of Health. So it has its outcome, it has its results already. This is in the process for finalization, for editing, and eventually for publishing. So in February of this year, the third meeting of the committee started and presented all the subcommittee plans and how we can move forward. Still, of course, this was put on hold, but I would like to share with you that in the next slide that the 5 subcommittees can we move. This is just a proof that we were participant in the 5th GGHH conference in Singapore. Okay, so the next slide will show you the different subcommittees we formulated. So we had the Energy Efficiency Subcommittee, the Plastic Waste Management, Food and Nutrition, the Plant Committee, and the Reusable versus Disposable Committee. They had their plans. They have already initiated their activities. There were calendars and timelines already. Still, it was put on hold because of this pandemic. Next slide, please. So among is a strong 1,176 personnel. Okay, but with the declaration, next slide, of the start of the enhanced community quarantine and the declaration of the code, initially code blue and then code red, sub-level 2, and then it becomes an international health concern, then a pandemic. A skeletal force was implemented, similar to what Dr. Parasa did. And you'd see that we only had 50% of the 1,176 personnel reporting to their offices per day. And this is with the objective of decreasing person-to-person interaction and to observe the personal or social distancing. All these are backed up by advisories, department orders of the Civil Service Commission, by the Department of Health, and the Department for Budget Management. Next slide, please. Okay, so when the declaration of the state of national emergency was done, it requires strengthening the workforce, particularly the frontliners in the healthcare system. We all know that in any agency or institution, it's the workforce which is the strongest key of the strength of any institution or an agency. So you have to motivate them, support them, and understand them by attending to their basic needs, their safety, and their health needs, which include their emotional, psychological, and spiritual needs. Next slide, please. So with the different civil service memorandum, We also had availment of leave privileges for absences, especially for patients with COVID-19-like symptoms, especially those who had travel history to countries or from countries that were identified to be COVID infested countries. These are the different privileges or the different alternatives that they can do. They can be uh, they can have absence for from work to self quarantine and or treatment, and the use of their vacation leave in lieu of exhausted sick leave credits, or the use of sick leave without pay in lieu of exhausted vacation leave credits. These are all backed up by the national agency of the government of the Philippines, since we are a national agency. So next slide, please. So what do you do? So of course, you have to attend to the basic needs of the health human resource. You provide them their food and nutrition, the shelter and accommodation, transportation. You give them just compensation and you attend to them to their health needs. Next slide. Next slide, please. Okay, so this is how we do it. We, our dietetics services provide free meals for all the 500 plus employees that are in the hospital on a daily basis. But we are so blessed with a lot of donors. In fact, we get almost 20 to 25 different partners in the non-government agencies and foundations. And I would say that the employees or the personnel and the frontliners are fed well. These are just examples of what we get today. So they're so abundant, and in fact, it lessens also the burden and the cost for our food allocation because while we should be preparing for 700 personnel, because of the food or the meals that we receive from morning till night, we just spend around 450 to 500 maximum for the employees to augment and to add on to our food donations. Next slide, please. So we provide them shelter and accommodation. As early as March 15, we thought of accommodating and providing shelter for our employees who will be affected by the ban in the transportation, by the checkpoints, by no accessibility to public transportation. So they would stay in our auditorium and in our executive lounge. We requested from our local partners, the LGU, for tents that they can give to us. And we are so blessed also to have a very strong partnership with our local government officials. And those are the tents that are usually used in evacuation centers. It becomes a very decent partition and division with privacy in a continuously air-conditioned auditorium and executive lounge. We have been accommodating almost 50 employees in this temporary shelter. Okay, next slide.
Doc Amy,
Yes.
if we can rush up the presentation so we will have time for the next presenter. Okay, go ahead.
Okay. So we also had a partners for accommodation. Next slide, please. Next slide, please. Okay. We have to price out. We have scheduled motor pool using our motor pool vehicles, including our dental bus. Next slide, please. Next slide. Okay, augmentation, and I think this is aligned with Healthcare Without Harm, GGHH. Less use of energy with bicycles. Okay, next slide. Okay, I've mentioned this, just compensations. Next slide. Okay, we can proceed. All right. Can skip that as well. All right. Okay. And of course, we attend to health safety needs, reduction of health risks, and we provide all this to our healthcare workers. Next slide. Okay. I have mentioned this, the different alternatives. So this is what we provide them. We do every week swabbing for the teams that came from a 1 week straight duty to ensure that they are not exposed. Okay, next slide please. We're almost done. And we started with online consultation to reduce the face-to-face contact with our outpatients. And we have started this since middle of March. We're on to our second month. And we get around one-third to one-half of online consultation from the usual face-to-face consults. Next slide, please. Okay, we keep reminding them of what to wear and we provide them this. Depends on the lowest risk area to the highest risk area. They are always reminded of what to wear to protect themselves. Next slide. Okay, so these are all posted strategically. Our additional health personnel are augmented with the department memorandum from DOH. Okay, next slide. Of course, we don't miss the psychological support. Our psychiatry department is on top of this. We encourage them to go online with webinars on different emotional, psychological, and mental support. Next slide, please. So those are just a few of the webinars and online sessions. Okay, and we don't forget the spiritual support. We run our Oratio Imperata on hospital paging system every 9 o'clock in the morning. This is a prayer for COVID-19. And we end our day with a 3 o'clock prayer. And I do my Monday talk every day on paging system just to make them feel that I am there with them all the time, always, and getting in touch with them and supporting them. So that's
Very good.
how we support our human resource. Thank you very much for listening.
Thank you, Doc Jaime. Again, don't forget to raise your questions in the chat box. I want to remind you about your questions. And maybe time to also raise the next question or our next solicitation from you by using Slido. The question is, can you tell what ideas that you can share to strengthen the health facility resilience in this time of pandemic and beyond? Give us your idea with what you heard and what you know and what you experience in your own setting. What are the other resilience measures that can be adopted to ensure that there will be less lives lost among healthcare workers and that there will be less waste that will be generated and that indeed we will have an effective management of an health emergencies such as this COVID-19. Ideas or actions you have for strengthening healthcare resilience. Now, do we move, Krisha? Is Dr. Kim ready?
I think Dr. Kim is now ready. Dr. Kim?
He may be, Dr. Kim, you may want to unmute the microphone so we can hear you.
He's already on video, but we can't hear you.
Otherwise, again, we will begin entertaining questions and then we can hear from him as we proceed with the program. Dr. Kim, is that all right? Paeng, my co-staff in Southeast Asia Office of Healthcare Without Harm, are already receiving questions. Paeng, would you want to start off with what you gathered so far?
Yes, sure. So good afternoon, everyone. So we have a few questions already in our chat box, and I think Dr. Kim is ready. But before we go back to her, there's one question that's pending. Maybe we can try to answer this one first, and then before proceeding with Dr. Woojin's presentation. So first question is addressed to Dr. Glenn Paraso. So the question is, Dr. Glenn, which area is or was the biggest unexpected change based on your strategic planning that you did earlier?
Was it unexpected change, right?
Uh-huh.
Yes, unexpected.
All right. So on the strategic plan, the biggest unexpected change was we were not ready to adapt to a situation of this magnitude. That was the biggest unexpected change. So um, we were ready for flooding or these other disasters, but not for a pandemic. So in the strategic plan, we did not consider having a disease pandemic, only the usual disasters, natural disasters of floods and earthquakes. So that was in our strategic plan, it was not considered. So really, we were not equipped to respond to a pandemic as big as this.
Thank you. If Paeng, is that all right? If Dr. Kim is ready, we will give way for his presentation. Krisha, is our presenter from Korea ready? Or shall I proceed with the open forum? Uh, Paeng has more questions, I think, to ask to our presenters. Paeng, go ahead.
Sure. Yeah, before that, I can see Dr. Woojin trying to be heard, but I think she's having problems with her mic, so we can't hear what she's saying at the moment, which is so unfortunate. But yeah, the next question is, so this can be answered by any of our doctors. So in the face of the pandemic, were hospital sustainability and health promotion activities being affected, or do you see the previous efforts that you've done support, or did it help a better response for the outbreak?
Who wants to go ahead? Uh, Dr. Harvey, Dr. Amy, or Dr. Son, you may want to respond. Yeah, Dr. Amy, I see you raising your hand. Please.
Yeah. All right. So the question is, our health promotion initiatives, are they in place in this pandemic? Did I get it right? Um, Pat?
So
Paeng, that's the
Yeah.
question, right?
Yeah,
yeah,
the
so
question is, our health promotion initiatives, are they of help in this situation? Well, I guess it is. For example, our public health initiatives were very, despite being a hospital, we have our public health unit, our family and community medicine safety partnership with our local partners and communities. It helps because even our health provider network is very active in working with the community on the control, on how to discipline the patient, how to tell them that the hospital is catering to emergency cases, and if not really needed to go to the hospital. You see, we experienced a decline by 50% of our usual operations as far as patient tending to patient is concerned, particularly in the outpatient. We see a daily normal 600 to 700 consults in the outpatient, but since the start of this pandemic, it declined to around 300. And that has been even narrowed down to face-to-face consult because we have been communicating well to our primary or secondary health facility partners. We have been very active in the social media, which is also part of our health promotion before this pandemic. So we are already used to our health education promotion initiatives and activities and applying this to communicate to our patients, to our partners, so that there will be a smooth and streamlined coordination attending to even the epidemiologic surveillance unit, which is very active right now uh, versus the regional, the national epidemiology. So it's already been in place since before, like for the past so many years. So applying this, it makes it efficient. It makes it handle our clients or patients or problems a little less complicated because we utilize all our health personnel in charge of such activities and programs. So it really does help, considering all these programs are under the flagship of the Department of Health and has been existing for quite some time already. I hope I answered the concern.
Yeah, you did. You did. Thank you very much. We have Dr. Kim now. I also messaged her that we do see her, but we don't hear her. Paeng, you have more questions in your hand?
Yes, we do. But I think if Dr. Hervey or Dr. Son would like to add something before we proceed to the next question. then-
Okay.
Yep.
Okay.
Okay, Raymond.
Go ahead,
Hello.
Dr. Herbie. Yeah, we hear you.
I think I want to add more about Dr. Aimee has talked before. Uh, I think the paradigm of the clean and healthy personal behavior should continue, and then even the pandemic is end, and it should continue, and we have to pass it on to our child so the children and our grandchildren can copy and assume as a good important behavior until they grow up. Because the pandemic situation has touched us about it is difficult to against the unknown viruses and it is difficult to cure the sick patient. So I think the idea to change the paradigm between how to cure, becoming how to promote and how to prevent is the good choice for us today. I think this is my opinion.
Thank you. Dr. Son, do you have anything to add at this point? Because Paeng, before your next question, we also prepared for this webinar some guide questions for our panelists. Unless Dr. Kim is ready, I'll shoot the first guide question for now. Okay, and this goes for everyone that has made their presentation. What could have been done better, or could have been done with if resources are available in a more efficient and effective way? Um, and as already we heard from Doc Glenn that they're not prepared, and I don't think anybody is prepared anyway. But what could have been done better? That now that we are into the third month of this pandemic, what would you have done, say in December or 6 months ago, if you know that this is about to come? So Glenn, are you about to say something?
Yeah, I'm thinking.
Your mic is on the mute, Doc Glenn. I think.
Okay, okay. All right. How's this? Is this okay?
Yeah, now we hear you.
Yeah. We're not really taking the SARS and the MERS disease that seriously. Although we had some cases, had
Mm-hmm.
we really studied that somewhere and applied it in a pandemic situation, we would have learned more. But I guess it wasn't that widespread. So
Mm-hmm.
it was contained easily, and so we did not have the resources to experiment with what are the possible training or response mechanisms because of the public health resources that are not really that much available. But as I was saying, if it is ideal, yes, we would have had training already in how to respond, training in communications, training in testing, training in contact tracing, and all of that. If we had
Okay.
known 6 months ago.
Okay. Dr. Herbie, I think, has her own thoughts about this. Dr. Herbie, the mic is yours.
Okay. Based on my presentation materials before, Raymond, I said that we have still homework for by our biomedical waste treatment. And because now we just make it simple for two ways of bins colored yellow and black for medical and non-medical waste. But I think if we have more resources to do, uh, we want to build a facility to uh, handle the biomedical waste and to make our biomedical waste treatment can go truly based on the BMWM rules 2016 or amended at 2018 and 2019. Because why? Because the biomedical waste management is very related with our environmental footprint because the amount of the non-medical waste and medical waste is higher day by day, even in the pandemic or even non-pandemic situation. So I think if we have more resources in our clinic, that we have to do is first try to give the expert of trying to find the expert to train or educate our health staff to handle our biomedical waste. The expert can simulating or can encourage, train our healthcare workers to begin a new habit for biomedical waste treatment. And then we can make it start with the how identifying the biomedical waste and based on the recommendation of BMWM, the category we know they segregation into seven waste bin categories color.
Mhm.
Yeah, yellow bin, red bin, the blue bin, and the translucent bin for the metal sharps, the green for biodegradable general waste, light blue for recyclable general waste, and black bin for hazardous and other waste. So it is a small step for segregation doing, but it is can be very important to make a great value for reducing our environment footprint. After the segregation simulation, we can going through how to collect, how to transport, and how to storage the medical waste safely. And maybe if there is any more resources, we have to uh, start to change our mind to reduce our chemical disinfectant for pre-treatment doing to the biomedical waste before disposal. As we know, we can,
Dr. Harvey,
yes,
yeah, let me ask us a supporting question on what you are explaining now.
yes,
And this goes for everyone as well. Most of you are members of Global Green and Healthy Hospital, and there's the 10-point agenda that
yes.
governs sustainability in healthcare. So let me ask all of you, how did the Green Hospital agenda of sustainability help you in dealing with this pandemic? I know you mentioned few things already, but just on that question, please tell us what is your key lesson in applying the GGHH agenda in a pandemic like this. So who wants to go first? Dr. Son or Dr. Aimee again? Or Dr. Glenn? Or otherwise, I can see.
Restart?
Huh? Who's that?
Juan, can I?
Yeah, please. Dr. Aimee.
Yeah. GGHH and resilience, of course, should have started with us hospital being self-reliant. No? Self-reliant meaning, and this is aligned with planting your own food, raising your livestock, practicing your strict infection prevention control, use of recyclable material. Have we been have had we started that? and maybe independence in times of pandemic when there will be shortage of food, shortage of supplies, will be very much come handy or will in place, and we will not be dependent on, like for example, I was saying we have a lot of donors, but had we started our own uh, planting, our own livestock raising, and then doing biodegradable waste into like fertilizer, utilizing it. That should have come handy because we will be not dependent on dole outs or donors. No? And then preparing efficient use of energy, having it in place will not be a problem with sustainability of energy supply for continuous accommodation, use of air conditioned unit. We were almost to that direction already, changing all our air conditioned units into more efficient ones. But had we done it earlier, I guess it could have been a more positive impact on the support for our healthcare, our expenses, our finances. So those are the two things maybe that could have been in place should had we been involved in the principles of green and healthy hospital in the first place, no, or earlier. So those are my
Thank you very much, Doc Jaime. Dr. Son, we want to hear from you your thoughts on the questions, including sustainability in your hospital in the middle of pandemic. Can we hear from you, Dr. Son, from Vietnam?
Yeah, I'm here.
We see you. Please respond. I think the microphone will be able to pick you up. Please go ahead, Dr. Son.
Okay. Um, I think that what should we do to deal with COVID-19? I think only uh, if only the health sector alone is not enough. We need to we require the coordination of the government and others. If we control too seriously, it will be lift up of the economy. But if we do not control so close, the it will be burnt out. So I think that if we can communicate to the way to protect self-protect. Uh, I think if everyone knows the way to self-protect, if knows the risk of infection, the risk when we first to get infected with other COVID, um, I think the number of positive patient will reduce. Like Vietnam, you see our
Yeah.
government so seriously with the travel visitor, with foreign visitor to Vietnam. We take care of them for at least 14 days and check the temperature. So the new
Thank you
phase.
very much, Dr. Son. Sorry, but we do hear you about managing infection with the preparedness of the hospital. And congratulations. I mean, looking in the case of the situation of Vietnam, you are one of those that are doing quite well in managing COVID cases. And we want to learn more from you. Dr. Kim now has the ball. We really want her even for the last 2 minutes. Dr. Kim, can you speak up, please? And you have the Dr. Kim's presentation in the screen. Dr. Kim, can we hear from you? Sorry, we really don't, we cannot access Dr. Kim. We will give you the opportunity in the succeeding sessions like this. As we said, this is a series of webinars that's meant to showcase the experiences of green hospitals in the Southeast Asia and East Asia region. So let us move forward and proceed to the closing. Unless my colleagues have to say a few more things. But I want to summarize it into three things, even as there is still the Slido question meant for everyone in the audience. Give us your action statement. What do we do from here on? Make use of your Slido and make that contribute that statement on actions that we can do from here on, ensuring that healthcare systems are indeed ready and resilient beyond a threat such as the COVID-19 that we are experiencing now. Okay, so key 3 points that I see in the course of the 1.5 hours of discussion. One, it is a given that no one is prepared to manage such a scale of a pandemic or a health emergency, which is COVID-19, the way we are experiencing now. However, the healthcare systems indeed have rise up to the occasion and to the challenge. It is not only the system per se, but it is the dedication and the commitment of the frontliners, the managers of the hospital, the supporting staff, but particularly the doctors and the nurses, that in a way is saving the day for us. And that's very clear across the experiences that you have shown and across all the experiences that we are seeing around us and even globally across this threat of COVID-19. Not ready, but you rise up to this challenge. Second, the whole issue of sustainability and resilience do matter, because what we are seeing and what you have shown in your presentations is that those that have already addressed, for example, better management of waste, are able to handle the volume of waste that come out. The PP, and you have said it yourself. You have that reusable, repurpose, better way of managing what could have been a disaster in terms of the single-use plastic that are mostly the PPEs and the masks. And that's resilience on one hand, managing waste. I'm hearing voice there. Is that Dr. Kim, Trisha? And that's the second point of the whole discussion. And the third, which is also amplified by Dr. Herbie and Dr. Aimee, and even in the first presentation from the Mary Johnson Hospital, is that this is a good lesson of why resilience and sustainability is critical, and the whole issue of disaster preparedness become important. We should not ignore any threat. I think Dr. Glenn said it neatly today, that they could have taken the earlier SARS and MERS-CoV threat seriously and prepare for this better. So I think and I pray that hopefully this pandemic will be over soon. If not this year, next year when finally we discover the cure to the virus or the vaccine. Meantime, I think the challenge remains that the march of the Global Green and Healthy Hospital on sustainability and resilience should move forward and higher even now that we experience COVID-19. And it is for this reason that we will get back to you, more consulting our members, hearing from you, documenting your actual experiences, which is what we're doing now. We will create cases out of the what you have shared so far, and circulate it even broader, and enrich the whole sustainability agenda, which is the Global Green and Healthy Hospital. So we would want to thank everyone from Doc Glenn Paraso, Dr. Herbie Nurwanya, Dr. Nguyen Wangson, Dr. Jaime Mateo, and even Dr. Woojin Kim, whom we know have stayed with us, have wanted to contribute, but for some technical reason was not able to do so. We'll give you the chance again in the succeeding sessions. To all our green hospitals, we salute you and we are with you. Thank you very much. And to all those who participated, who listened, and throw their questions, thank you for spending your time with us. We will have more webinars. Just wait for the announcement. But there are 2 dates already. One is May 29. We'll tackle the whole issue of chemicals. And on June 5, on climate, COVID, and health. We'll have a dedicated session on that. So good afternoon. Those in the Philippines, keep safe from the storm. And those from our colleagues in Southeast Asia and East Asia and the globe, keep safe from COVID-19. Thank you again.
Everyone, just a final announcement. We will share with you the presentations and recording of this event via email. We will also provide an activity report outlining the best practices and lessons learned in this webinar, including your answers to our slide polls. So we will choose answers or ideas in our polls to be featured in our Facebook, Twitter, Instagram, so watch out for that. Lastly, we hope that all this doesn't end here and that we all commit to do our action statements, no matter how small those acts are. So everything contributes for the greater good. Once again, thank you and have a nice weekend, everyone.